first question is, why are we in Arizona? Arizona has one of the best laws in integrative medicine probably in the country. The naturopathic scope is bigger, meaning doctors here can prescribe more IV therapies, more drugs than they can in other states. And we have a special licensure, which our medical directors have, called Medical Doctor of Homeopathy. It's an MDH. So an MD and a DO can get this special license, and that gives them an even greater scope where they can use other medications and drugs that you can't use injectable, intravenous in other states. So that really opens up the scope of practice. So, you might say, I want to put one of these in New York. Well, you have limitations in different states. In Arizona, you have the greatest legal scope of practice. And that's what really makes Arizona a special place. And the other thing is the weather is nice most of the year. It's a little bit warm in the summer, but all in all, we don't deal with major weather issues, and that's really helpful for patients who are chronically ill. The question regarding testing kind of goes hand in hand, because my point is, if we run very detailed tests. So you might come in from a doctor and say, I have let's say Lyme disease, I have a Western blot done for my Genix that says I have this Lyme and these co-infections. That's just the beginning, right? We need to know what the viral profiles are, fungal profiles are, mycotoxin profiles, parasitic profile, on and on. We need to understand the genomics of the patient. What do their genes look like? How are they metabolizing things? Break those down into different categories, not just methylation. We need to then look at what their immune system is doing, how their immune system is functioning, running series of tests. So it's typically what we see on average is our testing is multiple times more in depth than what patients usually come in with, even if they've gone to an integrative doctor usually. But the most important thing is, why would you bother running a test unless you have therapies and treatments that can help affect those targets? And that's why we're in Arizona, because not only can we run in-depth testing, but then we can put together aggressive and targeted treatment plans for each individual person, truly personalized, so that we can target and treat them. So this is way above what you might see in basic functional medicine or basic integrative medicine or basic generative medicine, because we have both the unique technology that we developed in treating and in testing, and when we combine those two things together, that's what we believe really helps us to help our patients. Now, of course, there are great doctors around the country doing little bits of these different things, and around the world doing bits of these things, and maybe even other things that we're not doing here. But I think I feel confident saying that based on conferences and doctors I've met from all around the country, we are really at the state of the art, or at the breaking edge of that technology, and we will continue to stay there until we can help more and more of our patients get well. That's our goal. So may God bless you on your journey to healing, and I wish you the best in getting well, and I hope that this helps answer your question.